Hello, my name is Sebastian Wicha. I'm a junior professor of clinical pharmacy at the Institute of Pharmacy, University of Hamburg in Germany. But I'm speaking to you as a program committee member of the ECCMID Congress, and I'm a member of the so-called Category 5, which deals with new antibacterial agents, PKPD, and stewardship. And most of you know ECCMID as the largest forum worldwide to discuss new research in clinical microbiology and infectious diseases, also foster education in these areas. And in my opinion, it's the most unique blend of basic and clinical research in a conference that exists. And I really encourage you to join ECCMID this year as well in very likely a hybrid format. And as you also know, ECCMID has different formats for the sessions and workshops. There will be excellent keynote speakers. There will be scientific symposia, 1 and 2 hours, educational workshops, as well as meet the expert sessions to just name the most important formats that are there. And I can also tell you that there will be many dedicated sessions to the COVID-19 pandemic, which is currently under development as we speak. It's end of February right now. And in this short video, I want to highlight a few categories, a few contributions from Category 5, from the category New Antibacterial Agents, PKPD, and Stewardship that I personally find very interesting and I think will also attract a larger audience. The first session I want to highlight is a 1-hour symposium, and that is entitled New Antibiotics in the Pipeline and on the Market, More of the Same or Real Innovations. And I think that will be a very interesting session to see to review what market entries for new antibacterial agents or other anti-infectives did we get in 2020 and in 2021. That will be the first talk. And then the second talk will go into more details, what we can expect until 2025. And I'm really looking forward to this session to hear about these innovations. The second session is a 2-hour symposium, and there we will honor one of our colleagues, Johann Willem Mouton, who passed away recently, and we will dedicate this session to him, and we will discuss challenges in using PKPD and TDM for dose optimization. And for those of you who know Johann, who you knew Johann, he was an advocate of using PKPD techniques. He was a long-standing member of UCAST, and in this session we will discuss many current challenges that the PKPD field is facing, such as hypermutable strains or how to use model-based approaches to optimize dosing, also how to include response markers for the treatment effect into PKPD approaches, and lastly also a very clinical focused presentation on when, for what drugs, and how to do TDM in clinical practice. Then there will be a session, an educational workshop session on PKPD and special patient populations, and that will focus on neonates. What do we need to consider when dosing neonates, children, and also a pregnant woman? What can be done similar to other adult patients? What is different from a physiological perspective, and how do we need to take these points into consideration when dosing these patients? Yeah, and the last session I want to flash out here is a Meet the Expert session, and that has to do with these devices. The clinical colleagues amongst you will certainly recognize this. This is a dialysator that is used in renal replacement therapy, and that is a focused Meet the Expert session with 2 excellent speakers that have a lot of knowledge in this field, which will speak about renal replacement therapy ECMO, which is also a very important topic, particularly at the moment, also with regard to treating COVID-19 patients. And the question that will be discussed in this Meet the Expert session will be, do I need to worry about dosing? So in what way do renal replacement therapies and ECMO alter the PK, and how can we account for these influences when developing dosing regimens for these very sick patients? So that were only 4 highlights I wanted to flash out here. There are so many more interesting sessions. And of course, it's not only about category 5, we have many other categories as well. But I just wanted to highlight a few things that I think might be very interesting at this upcoming ECCMID meeting. So I hope you are all staying well, and we see each other in July in Vienna or in a hybrid format. Stay safe, everyone, and see you soon. Bye-bye.